Hello, everybody. Good evening, good Sunday evening. This is Nurse Eunice with Florida Training Academy. If you'll go ahead and open up your chat, we'll be starting in about 45 seconds. I just want to know your name and where you're from. And so I will start it off. I am Eunice and I am in Jacksonville, Florida. Hey, Evelyn. Now, if I get some of your names, if I say it incorrectly, but I see Miss Pierre Louise. Is it Michou? All right. Hey, Miss Sandrine. And Miss Sandrine, I know you wanted to test on safety, I think. So we'll talk about that towards the end of this video. So everybody, good evening. This is Nurse Eunice. Hi, TT from Illinois. Hi, Paula. All right. So let's go, everybody. Let's start. Number one, you are a CNA in a long-term care facility. A resident's physician asks you to perform a procedure upon which you have not been trained. Your response should be A, I'll try it. B, I'll do it, but don't tell anyone because I'm not supposed to do this. C, no. D, I will get the charge nurse to help you. This procedure is not within my scope of practice. Hi, Rodinia. Hi, Delphine. All right, so Miss Yu says D. Anyone else? Hi, America from Texas. We'll reveal the answer in 3, 2, and 1. All right, great job, everybody. It is D. That is not within your scope of practice. So not all healthcare providers will understand the limitations of the role. And some are going to ask you to do things that are, not within your scope. It is okay for them to, for you to notify them that you can't, but also let your charge nurse know so that they can get the appropriate person in to assist. And this test is a mix of personal care and vital signs. So now we're going to go to number 2. Great job, everybody. Number 2 is a little bit lengthy. And number 2 reads, you take an adult's blood pressure and it is 40/20. You immediately report this to the nurse. The nurse returns to the patient room with you. She instructs you to place the patient in a Trendelenburg position while the nurse rechecks the blood pressure. You will blank to put the patient into the Trendelenburg position. Is it A, lower the head of the bed and raise the foot of the bed? B, raise the head of the bed up to about 60 to 75 degrees. C, raise the head of the bed up to about 75 to 90 degrees. Or D, raise the side rails and place the bed in a high position. What do you do? What is a Trendelenburg position? What is it used for? Great job, Renee. Great job, TT. Great job, everybody. It is A. And so when you're doing those vital signs, the patient is probably going to be exhibiting symptoms such as dizziness. And that's going to prompt you to put them in the bed right away. You put the blood pressure cuff on the arm. You press that button to get the nurse into the room. And so the Trendelenburg position is not a position you do without the nurse, but it's pretty much a guarantee if this person does not have respiratory issues that the nurse is going to ask that you lower the head of the bed. You're going to pretty much invert the person, and that's going to cause the blood from their legs to flow towards their brain, and that should kind of at least in the temporary, it's going to help with those blood pressures and help with that dizziness. That also gives the nurse time to start some IV fluid. So that's the purpose of the Trendelenburg position. Great job, everybody. Good afternoon, Marie. Hey, Peter. And I do apologize if there is a lag because I'm going to the next one and I don't see it on the TV yet. So let's see. Number 3, another blood pressure question. You take the blood pressure for your patient while they're in bed, and then you take it as soon as they rise from the bed and stand. The patient's blood pressure in bed was 152/85, and the blood pressure when standing was 96/46. You should A, report these blood pressures to the nurse immediately because these differences are not normal. B, know that blood pressure differences like these are normal when a person rises from bed. C, report the blood pressure while in bed to the nurse immediately because it is too high. Or D, simply record and document these blood pressures in the patient's chart. What do you think the best response is from 152 over 85 when in bed to 96 over 46 when standing? I'll reveal the answer in three, two, one. You're going to do A, everybody. So we call that orthopnic pressures. Whenever a person stands, their blood pressure can drop. It is A. Great job, everybody. A. Oh, no problem, Renee, that you don't know much about blood pressures. But sometimes a patient, they'll have those compression holes because if they stand, the blood, of course, wants to flow down because of gravity. But the person's blood pressure can drop significantly, as in this particular scenario. That would not be normal. You want to put that person back in the bed and notify the nurse. And so here's the response. So the explanation, you should it should be repeat these blood pressures, or you should report these blood pressures to the nurse immediately because these differences are not normal. Although blood pressures vary slightly from lying to sitting, they do not change this much. So if something changes more than 10 points, just let your nurse know. It's best to be safe than sorry because we want to protect that patient. So great job for everyone who chose A. Number 4. When CNAs do pulses, they should note which of the following. And if you've not taken a pulse before, the radial pulse is at the wrist. Remember that we don't take pulses with our thumbs because our thumbs have their own pulses. So you're going to use 2 fingers or 3, usually the index in the middle or the index, middle, and ring finger. So you have your fingers on this person's pulse. What are you checking for? A, the rate. B, the rate and quality. C, the rate, quality, and fullness. D, the rate, quality, fullness, and regularity. Barrett, you got it. It is C. Good job, Joyce. Good job. All right, so rate, quality, and fullness. It is C, everybody. When you check the pulses, these are some of the characteristics you want to be checking for. The rate is the number of beats per minute. The quality is whether or not it's regular or irregular. And the fullness, when someone's dehydrated, they're going to have a weak pulse. But if you take a younger person's pulse or someone who's well hydrated, you're going to feel a more bounding pulse. And those things are really important. And you'll learn more as you go on to nursing school. But just from a CNA standpoint, if you feel a really weak pulse, that's the sign of poor circulation. So great job, everybody. Barrett, where are you at? Because you said good morning. All right, so number 5, you weigh the primary care patients using a floor scale. You must be sure that the scale is blank before the weight is done. This is easy, everybody. What do you do to a scale before you put someone on it? Do you A, I guess weigh them in kilograms before you put them on it? Do you weigh them in micropounds? What in the world is a micropound? C, do you put the scale on 0? Or D, do you put the scale on 1? I know that was too easy for you all. Everybody got that one right. So good job, everybody. You are going to 0 the scale before you put the patient on it. Remember, if the scale is not properly calibrated, the weight will not be accurate. Number 6, when you do daily weights for patients, the most accurate weights are taken when? A, on the same day of each week. B, in the afternoons only. C, in the evenings only. Or D, at the same time each day. When do you get an accurate weight? Great job. Hey, is it Umo or Yumo? Good morning, good afternoon, everybody. It is D, everybody, at the same time each day. Daily weight should be done on at the same time each day and every day, preferably in the morning after the patient has voided. What does it mean for a patient to void? And before breakfast. So don't take the weight at the same time every day after breakfast because we have the person has drank, they've drank coffee, they've had water. So we want to try to get that dry weight. What does it mean? Great job. What does it mean if a patient voids? What does that mean? What does it mean to void? right, I put it in the chat. What's the definition of voiding? Void is they are using the bathroom, but are they urinating? Good job. So usually when we say void, it's specifically related to urinating. So great job, everybody. Now I have another question to follow up. What type of patients would need to be weighed every day? What are some illnesses or conditions in which a patient would need a daily weight? Yes, Rodinia. So somebody who we need to monitor their output on. Um, can anyone give me an example? I'll help you out. It's a problem I don't have. Someone who's malnourished. If someone's malnourished and they're in your care, maybe they are anorexic. Heart disease. Yes, yes, yes. So looks like it's the, I don't want to mispronounce the name, the Lockyer family. This test is for it's just a general test. It's for nationwide. What I'm teaching you is good throughout the nation. So it's not specific to the Florida state examination. It's just specific to basic care. So yes, congestive heart failure. If they have heart disease, hypertension, they should not be eating all that sodium and salt. And when the family's in there sneaking them the Popeyes chicken, when you weigh them the next day, they're going to have fluid retention or weight gain. If they usually gain more than 3 pounds within a few days, that's pretty much a medical emergency because their hearts can't tolerate it. So if somebody has congestive heart failure or heart disease, we usually weigh them every day. Why do we weigh somebody every day if they have kidney disease, if they're on dialysis? What is the kidney's roles? What do the kidneys do? Oh, you all are quiet. So I'm going to help you out. The kidneys filter and they remove excess fluids. So when someone's on a renal diet, aka they have kidney disease, they should be weighed daily also because we don't want them very good. It cleanses and it filters. We don't want them gaining too much weight because if they gain too much weight, it's from fluid retention and they could go into congestive heart failure also. So great job, everybody. And also don't forget to weigh your pre-op and your post-op patients. Pre-operatively, you'd be weighing them so that we can get that baseline weight so your nurse doesn't give too much anesthesia or your doctors. And then post-operatively, the next day we'd be weighing them, and that's how we can tell if they are retaining urine or if they are losing blood. So great job. Number 7, you need to get Mrs. Leeds up from the wheelchair and back to the bed. The first step is to check to make sure the bed and the wheelchair are in a safe position. Which of the following describes the safe position of the wheels on the bed and the wheelchair for a transfer? You all should know this. A, bed wheels unlocked, and wrong answer. B, bed wheels locked, but then the wheelchair wheels unlocked, and wrong answer. Does everyone agree with me that C is the best answer, that you want the bed wheels locked and the wheelchair wheels locked? Yes. Yes, Miss Sandrine. Great job, Joyce. So it is C, that is safest. And some of our new fancy beds, they have little lights and indicators that will tell you when the bed is unlocked, but the wheelchair won't. So just make sure that you check both before you complete a transfer. And also, a lot of your facilities now use gate belts. And if you have not been taught to use a gate belt, I'm sure you will in the future. All right, number 8, the nurse delegates a specific task that you must perform now in addition to your assignment. This nurse then gave you extra work. Oh, Lord. You may A, ask another CNA to complete the task if you are too busy. B, tell the charge nurse you will do it when you can. C, complete the task as soon as you can. Or D, complete the task and tell your residents the nurse is giving you extra work and that is why you are behind on your care. Yeah. No, not both, Brad. Great job, everybody. C. Yes, so the nurse supervises the CNA and may legally delegate tasks that are within the CNA scope of practice. The work requires a CNA to be flexible, pleasant, mature, when asked to perform any additional task. And I love working with CNAs. And a little fun fact, when I started my business 15 years ago, I didn't start it with a nurse. I started with a CNA. So a good CNA and a good nurse, they just make a great team. All right, number 9, nursing care plans contain which of the following? A, nursing diagnoses, B, medical diagnoses, C, MD orders, which will be your doctor's orders, or D, intake and output forms. Nursing care plans are specific to the nursing team, and as a CNA, you are a part of the nursing team. What do you care about? I mean, the MD orders are usually in the chart. Where do you find like your interventions, the things that you have to perform? For this one, it's not C, Peter. It wouldn't be the MD orders. It is A, Stephanie, those nursing diagnoses. So the nursing care plan has the nursing diagnoses. And how does that relate to the CNAs? Because the nursing care plans are legal documents that contain the diagnoses, as I already stated, such as alteration of respiratory function. They also contain patient goals and nursing intervention. So if you have somebody with an alteration of respiratory function, do you keep them in bed all day? No, I'm going to need my CNA to get them up. Even if they can only just get up to the chair. Whenever you sit someone up, you actually improve their respiratory state, because you make some of those fluids travel. If they have congestive heart failure, pneumonia, those fluids are going to start moving. You're going to encourage them to cough and to deep breathe. And so whenever you look at the nursing diagnoses, it also shows the part that the CNA plays in the nursing care. So great job, everybody. Number 10, you are working in a healthcare setting that cares for people with chronic physical healthcare problems, chronic long-term healthcare problems. Which type of healthcare facility are you most likely working in? A hospital, B, a nursing home, C, a health department, it's not C, D, a physical rehabilitation center. Chronic healthcare problems. So usually, everybody, your hospital, it is B, TT, it's B, Rodinia. A hospital is for acute, so new issues. The hospital is to get you stabilized and to get you home. We don't usually have patients in the hospital long term unless we don't have a place to send them. If they have a chronic condition, let's say it's somebody who's intubated because they went into respiratory failure and we have to keep them alive on the vent, they're only going to stay in the hospital for as long as they need to. We're going to send them to a long-term care facility, such as one that focuses on vents, but your nursing homes usually take care of those type of patients, okay? And then as far as those with physical issues, let's say someone had a stroke or a motor vehicle accident, they would go to a rehabilitation center so they can learn how to walk again. Number 11, you're providing mouth care to a patient who is in a coma. You should blank to provide good and safe mouth care. A, keep the head of the bed up so the patient does not aspirate. Listen to all the options because it's not A. B, brush the teeth and rinse the mouth with a cup of water. C, use a special foam swab to brush only the tongue. D, use a special foam swab to brush the tongue and the teeth. A person who's comatose doesn't have a gag reflex sometimes. This person's at risk of aspiration. So what should you use? Yes, everybody, it is D. You're going to use that oral swab, and that's how you're going to cleanse their mouth. So here's the explanation. Patients in a coma also need mouth care, but you have to modify the mouth care procedures. We usually don't sit them upright because if any fluids drip into the back of their throat, because they're in a coma, they can't cough them up. So that means those fluids may travel to their lungs and they may aspirate. So one of the best things to do is when you're using that foam swab, whether you have suction or not, turn them to the side. And when you turn them to the side, those excess fluids accumulate in the cheek. If you have a suction wand, you can just suction it out. But if you're in home care providing care to a comatose patient, just don't put a whole bunch of fluid, just a little bit of mouthwash on that swab. Go in and clean their teeth, gums, and their tongue. And that's something we recommend you doing at least every 2 to 4 hours. So great job to everyone. Number 12, you are caring for Adele T. She is a 56-year-old diabetic who was admitted to the hospital for breast cancer surgery. You notice that her toenails are jagged and they need trimming. You should do which of the following: A, report the condition of her nails to the nurse. B, clip them because CNAs can clip toenails. C, tell the patient to clip them herself. It is her job. Or D, use heavy and broad toenail clippers to clip them. And looks like TT has it. It is A. Does anyone else? Good job. Good job. So it is not within the CNA scope of practice to clip anything. You're not going to clip. And this lady has enough going on. Right now, she's fighting for her life. She has cancer and diabetes. So you're not going to tell her that's her job. You're going to report the condition of her nails to the nurse. And whenever you report it to me, I will more than likely call the doctor, who's going to call a podiatrist, someone who specializes in those diabetic toenails. What are diabetics at an increased risk of contracting? Why don't we just go in and clip and do things to a diabetic patient? Even a patient who has cancer, they also have a weakened immune system. So they're also, I'm just going to give you the answer, they're at more risk of getting infections. So we don't clip, okay? And then even if the patient is not a diabetic, they could be on the blood thinner. So don't clip any nails, notify your nurse. 13. The primary purpose of a patient care meeting or conference is to determine which of the following: the patient's ability to pay for the cost of their care, how the healthcare team can best meet the patient's needs, C, the patient's physical status and condition, or D, the patient's psychosocial status and condition. What is the purpose of a patient care meeting? The CNAs attend the patient care meetings because you all know more about the patients than anyone else. You spend all the time with the patients. So, what do you think the answer is? Yes, it is B. A patient care meeting, we meet and talk about the patient's needs. And again, you all are so important. You're so valuable. As the nurse, I'm ripping and running. I work differently than you. I have to call the doctors. I'm dealing with the family. I'm passing the meds. The patient's going to be speaking to you a whole bunch more than they're speaking to me. And so if there is a need, we need for you to present that during the meeting. Great job. Number 14. You have applied for a position as a CNA with a temporary staffing agency. Oh my God, I'm here in Florida. When I tell you that them traveling CNAs, they made some good money. If you are interested in traveling or doing staffing, once you have experience, by all means do so. So I'm going to go back and reread this because I got distracted thinking about how much money those traveling CNAs made. But number 14, you have applied for a position as a CNA with a temporary staffing agency. All of the following items will be the same between your temporary staffing position and the skilled facility where you used to work as a full-time employee. Which item will be different between the two types of work? A, assignments and locations can be accepted or declined. B, CNA task. C, teamwork. D, shifts are not guaranteed. If you're working with a temporary staffing agency or a traveling agency, what's the difference? All right. I kind of agree with you all about the teamwork. Because sometimes when you're a traveler, or if you're a staff CNA or a staff nurse, the teamwork's not there because you don't know the team. But technically, you're supposed to work well with anybody who's in the facility with you. So even though I agree with you, the answer is not C. The answer is A. its assignments and locations can be accepted or declined. So pretty much you get control of your schedule when you're working as an agency CNA or an agency nurse. Whenever you're a traveling CNA or a traveling nurse, they're going to contract you for, 13 weeks or whatever. So you have less control over your schedule. But at a temporary staffing agency, you will be offered locations and assignments, which you are free to accept or decline. But once you accept an assignment, you will perform CNA functions as assigned. As an employee at a skilled facility, you work at one location and you cannot decline your assignment. Furthermore, your shifts are not guaranteed in either type of work because at skilled facility, shifts are census and staffing dependent. So if the census changes, meaning that they have less patients, they may send you home, regardless as to whether or not you're a staff CNA or an agency CNA. All right, so I just saw it there, Brad. Good morning. Good morning. It is 7:55 in the evening here in Florida. So number 15, which of the following is not a part of a CNA's routine personal care of a patient? A, haircuts. B, perineal care. Remember, perineal care is bathing of the private or the genital area. C, facial shaving. Or D, foot care. Yes, Chantel, it is A. Yes, Uma. Yes, yes, yes. A, great job. You all do a lot, but you're not a cosmetologist. Don't cut anyone's hair. So CNAs do not cut hair. They can shampoo it, comb it, brush it, and style it or braid it, but they do not cut it. For those of you who are not familiar with natural hair on African Americans, I have locks. And I let all of my students touch my hair, especially if they don't know how to provide care to somebody with locks or somebody who may have an afro. And so if you are from a culture that differs from your residents or your patients and you don't understand their hair texture, go ahead and ask, because hair care is important. Hair hygiene is important, regardless of the race or the nationality. Whenever someone has fine hair, if you keep that hair loose behind them, if you and it may become matted, they may have to cut their hair. But if you have somebody who has an afro, you can't comb an afro. You have to pick an afro. So when in doubt, it is okay to ask. I'd rather you ask so that you provide good care to all of your residents versus having some of your residents looking neater than others. Number 16, the RN has assigned you to empty urinary drainage bags for a group of patients. You should take which of the following actions? A, tell the RN that CNAs are not permitted to do this. B, complete this task and report the task completion to the nurse. C, disconnect the catheter tubing from the drainage bags. Oh, if you do that, you're going to have urine everywhere. That's nasty. Don't do that. D, kink the tubing before emptying the drainage bags. All right, so you've been assigned a task to empty urinary drainage bags. What action do you take? You know it's not C. Renee, you won't let anyone touch your locks? Hopefully that will change, unless it's for a religious reason. Hopefully that'll change when you go, become a nurse, because if you're teaching people, you have to let them know how to take care of people who have unique hairstyles. So, all right, so everyone, the answer is B. You all did it. Hey, Kador. Great job. Hey, Jill. Is it Shirley? Hey, Miss Sherry. So, yes, CNAs are able to empty urinary drainage bags. They've been trained to do this task, and it is within their scope of practice. They should also report to the nurse that they have completed the assignment. However, you do not want to disconnect the catheter tubing, as that is a sterile procedure that should only be done by the nurse. And you don't want to kink the tubing because that's going to cause a backflow of urine back into the bladder, and that can cause bladder distension and pain. Number 17. Let's see. That's the skill you practiced tonight. Very good. All right, so number 17, the nurse knows you wish to further your education and ask if you would like to insert an indwelling catheter on a resident. Which of the following is an accurate statement regarding the situation? A, CNA should take all opportunities to learn new skills. B, inserting a catheter is a sterile procedure that is not within the scope of practice. C, the nurse can delegate any task to a CNA. Don't let them do it to you. They go have you try to do everything, but they're getting the nurse money. So the answer is never C. And D, the resident will not mind because he trusts you as a CNA. All right, so we know the answer isn't C. What is the answer for number 17? Great job, everybody. And I do apologize if you hear some rattling overhead. My heat just decided to turn on. So you all, it's cold in Florida. We have the heater on. This sucks. Yep. So it is B, everybody. Inserting a catheter is a sterile procedure that is not within the CNA scope of practice. Performing procedures outside your scope of practice places you at risk of revocation. That means they can take your CNA license and other legal issues. CNAs are responsible for knowing and abiding by the legal boundaries of their scope of practice. Number 18, this is easy. Who is the center of care? The nurse, the doctor, the administrator, or the patient? Who is the center of care? Yes, TT. Renee, you had the heat on last night too. Yeah, we don't like being cold. It's too cold in Florida right now. The patient is always the center of care and the center of the team. The patient is the most important member of the team. Everyone should work together in order to ensure that patient receives quality care. Number 19, we only got 6 more to go, ladies and gentlemen. You are a CNA on the Alzheimer's unit. Some of your residents are difficult and aggressive. One of your coworkers always puts Mrs. James and Mrs. Jones' wheelchair side by side because she seems to enjoy watching them bicker. She has often commented on how amusing this is. How can you relieve this situation? So she is using these elderly patients as a form of entertainment and sitting them next to each other so they can argue. Do you do A? If you see these residents side by side, move one or both of them away from the area. B, tell the coworker that you feel that these two should be separated and let her handle it. C, discuss the problem with the coworker and help her move the residents. Report the situation to the nurse. D, do nothing, as socializing, even bickering, is good for the residents. Yes, everybody got it. It is C. Whenever you have a problem with someone, you want to address them. You're going to address it respectfully, but there's going to be boundaries. It's like, hey, I don't think this is right because you're actually upsetting them. And whenever you have an Alzheimer's patient, you want to decrease stimulation. So if you have them bickering, well, then you're going to increase their confusion and their frustration. So you can go at it from that viewpoint, but also let your nurse be made aware. Number 20, a CNA cannot perform which of the following tasks? A, blood pressure measurement. B, passive range of motion. C, the application of an antibiotic cream. Or D, the application of body lotion to the feet. Which is not a task that a CNA can perform. Yes, yes, yes. You all are awesome. You all did very well tonight. I'm really proud of you. It is C. I'm so proud of you. The application of the antibiotic cream. Remember, the CNAs cannot administer medications. And don't get confused, because I know sometimes those who are in hospitals or some of the nursing homes, they may do more. But for your test, for your CNA test, right now you cannot give medications. You cannot perform sterile procedures. You've not had any additional training. So the answer is always going to be no for anything involving sterile procedures or medication administration. 21, I have a lot to read here, so let's start. 21, you are a male CNA working with an all-female staff. You are assigned your own residents just the same way the female CNAs are, but you are frequently called upon by your coworkers to leave your residents to help them with a lift or heavy resident. How can you best handle this? We love our male caregivers. Stop abusing them. They're not superheroes. And if you do abuse them, please feed them accordingly. They do like steaks and stuff. All right, so that's just my little pointer. If you want these male CNAs, these male techs helping you all the time, make sure you help them. So A, Help your coworkers and try to catch up on your own work when you can. B, discuss the problem with your coworkers and see if there are tasks they can do for you so that you can help get your work done on time. So you're the male caregiver. Everyone keeps calling on you. C, tell your coworkers that you have your own assignment and you do not have time to help them. Or D, tell the assignment nurse that due to the problem, you need to have a lighter schedule to be able to assist others. What do you think the best response is? Serena said B, Joy said B, DH said B. So great job, everybody. And remember, if someone's calling on you all the time, you want to be nice to them, but at some point they're going to have to give back. So yes, you're going to discuss the problem with your coworker and you're going to see how they can help you also. It says answer A is incorrect because while it is good to be a team player and help, you may be unable to finish your own work, and this will reflect poorly on you because you're trying to help everybody else. Answer C is incorrect because this answer defeats team building, and answer D is incorrect because going to the scheduler and asking them for a lighter assignment, that would not be good for team morale. So great job. Number 22. You have accidentally nicked the patient's neck when you were shaving them. What should you do? A, take the patient to the emergency room. B, apply pressure and report it to the nurse. C, pinch the skin and put antibiotic on the area. Or D, never use a regular razor. Use only electric razors. Yes, Stephanie and TT and Akuna, it is B. Yes, everybody. And so whenever you nick a patient, they may be on blood thinners. So it's going to appear scarier than what it is. I need for you to remain calm, apply pressure. If you don't have the call bell or the call signal right there with you, have the patient put his finger to that spot so he can apply pressure while you go out and you get additional help. That's going to be easy to resolve if you stay calm and get the nurse in the room. So yes, B, apply pressure and report it to the nurse right away. Number 23, when providing personal care for a resident, the CNA should allow the resident to do as much as he or she is able. D, do as much as possible for the resident. C, tell the family their assistance is required with resident care. Or D, select the products used for personal resident care. So someone has had a stroke. One side of their body is weak. Yes, Joyce, you want to do A. You're going to allow the resident to do as much as he or she can. Our job is to keep them as independent as possible for as long as possible. So we don't do everything for our patients. We do as much as we need to do. And so, ladies, whenever you're giving a male a bath, if you've seen his hands reach down towards his genitals, and men, vice versa for you, whenever you're giving a woman a bath, see how much of their genital care they can do on their own. Give them the washcloth. Let them assist you. There are some areas of the body because when they get home, they're going to have to take care of it. So at least see what they can do. Plus, it'll be less uncomfortable for you and for them if you allow them to participate and reach those personal areas. Of course, if they can't, that's when you'd have to do so. And if you haven't subscribed to our channel, go ahead and do so. We do provide these videos and the CNA playlist. We have a clinical skills playlist, and we also have our practice question playlist that has hundreds of questions. So there's no reason for you to fail this test. My job is to get you all out there and get you working. I love working with CNAs, and I've been training CNAs now for 15 years. So I thank you for what you do. And again, I just love working with you. All right, so we just talked about number 23. And number 24, winning teams. A, focus on solutions. B, keep the same leader. C, focus on policies and procedures. Or D, judge other team members. I don't like her anyway. She always late. A letter of explanation to the DON. I have no idea what that is, Renee. So I'm going to give you my email address because some states have different requirements. I don't know what a letter of explanation is. When teams focus on solutions, you all, we are not problem focused. If we see a problem, we're going to find a way to solve the problem. So winning teams focus on solutions. All right, so winning teams focus on solving and preventing problems. They are also share leadership roles among all the members of the teams. They do not judge or attack members of the team, and they strive to be creative and come up with new solutions for old and ongoing problems. Hi, Stephanie from New Jersey. You all, I'm going to miss you. We're on our last one. But before we get off the live today, I want you all to put in the chat and tell me what you think the next video should be about. I know someone said safety. Do you want to focus on vital signs? I have half a day off tomorrow, so I can create new slides tomorrow and give you exactly what you want. So if there's something that you want to learn more about, please put it in the chat now. And we're on our last question, number 25. You are the CNA taking care of Mrs. Lee in room 232, bed 2. You are not assigned to take care of Mrs. Libbs in 232, bed 1. Safety, please. Communication. Awesome. The CNA who has been assigned to Mrs. Libbs has asked you several times to perform care on her patient. Mrs. Libbs is now asking you to perform care on her also. So now you got both patients in the room and you're only assigned to one. How should you address Mrs. Libbs' request for care? Okay, so I have communication, I have safety, and I have infection control. All of those are great topics. All right, sorry, I had to stop and write those down because I don't want to lose them in the chat. All right, so I see a lot of people, let's see, someone put A, someone put D, but A is perform the care, even if it interferes with your other duties, as CNAs must work as a team. D, tell Mrs. Lib that you will get her caregiver because she is not your patient. C, since you have to walk past her bed to reach your patient anyway, just take care of her needs as well. D, perform the care if it does not interfere with your other duties, but tell the responsible CNA that you cannot care for her patient and inform the assigning nurse about the situation. Yes, everybody, it is D. All right, Akuna, your test is on Wednesday. We're going to be praying for you, Akuna. Good luck in advance. And then someone else said perineal care. So Joyce wants something on perineal care. We do have a video on perineal care, Joyce, so I'll make sure I send it to you. So everybody, I am so proud of you. That was the correct response. It was D, because the patient comes first and she's seeing you. She's in the room with your other patient. And so you're going to provide the care if it does not interfere with your other duties, but you're also going to seek out that coworker and diplomatically, respectfully point out the situation and ask her to take care of her patient. Guess what, everybody? You did it. And I am so proud of you. Nurse Eunice loves you. I appreciate you. Thank you all for tuning in. And then I see you there from New York. And I think this week I'm going to try my best to, I'll make sure I repost that video in the community section about perineal care so that you can watch that one. I'll do that tonight before I go to bed. But then I will try to create a video on communication, safety, and infection control this week. You all are awesome. I appreciate you all so much. And yes, good luck in advance, Akuna. You're going to pass this test. Anyone have any last comments that you want to put in the chat before we head out? Thank you, TT. You're so wonderful also. And then Joyce from Kenya. I appreciate you all. When you say body function, DH, what do you mean? Can you be more specific? You're welcome, Stephanie. You're welcome, Kador. You're welcome, Chantel. And I'm going to put, God bless you also, I'm going to put my email address in here one more time, DH. And then I think it was also someone else who had a question about a letter for the director of nursing. But then that way you all can communicate with me directly. So it is admin, ADMIN, at fltraining.com. And we're going to be ending this live, everybody, in 3, 2, and 1.